Well, speak of COVID-19 funding, a research by the COVID Transparency and Accountability Project CTAP on Ghana has shown a possible misuse of COVID-19 funds due to an inefficient reporting system. The study, championed by civic organization Budgets Ghana, was to determine how transparent and accountable government has been on the usage of monies intended to tackle the impact of the pandemic. Refifi Nkum is country lead of Budgets Ghana, and he has been highlighting aspects of the report.
Basically, what we sought to do with this project is to find out how accountable government is being with COVID-19 fund disbursements, given the huge inflows that came in from international partners and some monies that were internally generated to tackle the pandemic. And what we were looking out for is the e-procurement platform to include information on the procurement plans from each of the institutions that were charged with tackling the pandemic. We were expected to see contract package descriptions. We expected to see estimated costs for each of the packages, the procurement plans the procurement methods that were used. But this information is missing on the public procurement website, which makes it difficult to ascertain exactly which companies were awarded the contracts, and it makes accountability quite difficult. What we had to do was go down onto the ground and speak to healthcare professionals. Some reported having had adequate access to PPEs and the other relief packages, but there are some complaints. So what helps, what makes it very easy is to open up and publish those details, the procurement plans at the local government level, to enable institutions like ours to easily track the spending. Other countries have done so. We know that even though there were emergency procurement engaged, it's still useful for us to have access to these procurement plans at this time, given the fact that it's already been a year. And it's especially important right now because we are going into the third wave and people want to know how much we spent to handle the first and second waves and how generally the battle against the pandemic is going. So this is the information that we are looking for. We need an audit report of each of the items in the COVID-19 project, who was awarded contracts for fumigation, testing and tracing, how are healthcare workers being supported, how are the local governments being supported in sensitizing people about the public, especially with the vaccination drives as well. These are the questions that we're interested in and that the project seeks to foster. We're going to have a phase 2 that's going to specifically focus on vaccinations,